This video will introduce you to the many blood vessels present on this torso or Mr. Muscle model. In order to see the blood vessels, let's take a look inside the body. Okay. Note that on this model, the arteries are red and the veins are more of a purple color. Okay, so let's start with the arteries. This is where the heart would be. Okay, so this is the aortic arch. Okay, let's take a look at some of the branches off of the aortic arch. First of all, this is the right common carotid artery going up to the head. All right, the left common carotid artery is a little bit obscured, but there it is back there. Okay, the right subclavian artery, okay, we can see right here, again, a little bit hard to see, but this red blood vessel here is the right subclavian artery. Okay. The next vessels are going to be in the abdominopelvic cavity. Okay, let's follow the red, so following the arteries still. This blood vessel here is the abdominal aorta. All right, the first branch is off of the abdominal aorta is this right here. Number 23 is the celiac trunk. All right, so we can see two of the three branches off of the celiac trunk on this model. It's not 100% clear about where exactly those blood vessels are going, so the important take-home message here is this entire thing is the celiac trunk, number 23. And we know that one of the branches off the celiac trunk is the splenic artery, and we can see way over here to the left, this is the red vessel, the splenic artery. Right? This is the spleen, the red is the splenic artery. Okay. The second branch off of the abdominal aorta is this right here. This is the superior mesenteric artery, and we can see that it's actually just superior to this purple vessel here, which is the left renal vein. Okay. This red vessel is the right renal vein. Okay, so let's go down a little bit farther on the abdominal aorta. Right. Next, we see a branch off to the right, and we see a branch off to the left. These two red vessels are the gonadal arteries. Right, and the final blood vessel is the inferior mesenteric artery. Okay. The abdominal aorta ends when it splits into the common iliac arteries. Left and right, common iliac arteries. Right, if we go down a little bit farther, we see that the left common iliac artery is going to change names when the vessel splits. Okay, one branch is going to descend into the pelvic cavity. This branch right here is therefore the internal iliac artery, and the remaining blood in this vessel over here, this vessel is called the external iliac artery. Okay, so this vessel would ultimately travel over the pelvis and down into the leg over here. Okay. On the right side, we can see the common iliac artery, the external iliac artery in red, and as soon as it travels over the surface of the pelvis, it changes its name to the femoral artery. Okay, so now let's switch gears into the veins. Okay, this vessel here is the femoral vein. External iliac vein. Over here we can see another external iliac vein, common iliac vein. Okay, and we know that there is a branch, a little bit difficult to see, but we have a branch off of the common iliac artery. So this is the internal iliac artery. And right back here, we can just barely see the internal iliac vein as well. Okay, going up, where the two common iliac veins come together, we form the IVC, the inferior vena cava. Okay. Next, what we can see is another tiny little branch here and over here. These are the gonadal veins. Remember that the left gonadal vein does not drain directly into the IVC. Instead, it drains into the renal vein, the left renal vein. Okay? And finally, the IVC is going to drain blood back into the heart. Okay? There are just a couple more vessels, and those vessels are found on the inside of the thoracic wall. Okay? What we have are the internal thoracic artery and vein. So this red vessel here is the internal thoracic artery, internal thoracic vein. And we can see that there are many branches off of these vessels that are actually traveling between the ribs. And so these are called the anterior intercostal arteries and anterior intercostal veins, depending on the color. Just a couple more vessels to point out. Up here in the thoracic, we know that the superior vena cava drains blood from the head and the arms back into the right atrium of the heart. The two vessels that come together to form the superior vena cava are these two right here, the brachiocephalic veins, the right and the left brachiocephalic veins. The first branches off of the brachiocephalic veins are these right here. These are the right and left internal jugular veins. Okay, we can just barely see an external jugular vein that has been cut off. Okay. Right here, we can see this vessel, which is together with this red vessel over here. This is the right subclavian vein versus the right subclavian artery. Okay, as soon as both of these vessels pass deep to the clavicle, of course, they change name. And so this vessel right here would be the axillary or axillary vein. Okay. One more point to note down here in the legs. I previously told you that this blood vessel right here was the femoral vein, or the right femoral vein. Now, we can see here that a vessel has been cut off on the right side, and we can see that vessel over here on the left side. The more medial blood vessel is called the great saphenous vein. So here we can see the left great saphenous vein. Here we can see the right femoral vein.